Hi everyone, today let's understand agonist and antagonist drugs in a very clear-cut manner. So first what happens? Okay, so this is a drug. When it's bind to receptor, we get response. This is a general theory, right? So now what happened is, let's see the example of this theory. Suppose adrenaline. When binds to beta 1 receptor, the response is increase in heartbeat. Now, so how we'll come to know? And if you see agonist drugs, first of all, what is agonist? How we will come to know that drug is agonist or not? For that, we need to understand the receptor affinity. What is receptor affinity? Is ability to bind receptor. So ability of the drug to bind the receptor. Hence we get the response. The response is in which way? In intrinsic way. That is intrinsic activity. Okay. So let's see agonist. So what happened in agonist drug? Yes, there is ability binding. There is ability to bind the receptors. The drug will bind, and we'll see maximum plus 1 response. That is, we will have maximum response. And next, that is partial agonist. So what is partial agonist? There is ability to bind the receptors, and the response is 0 to 1. That is minimum response, not too much. Okay. Then next one is antagonist. So antagonist, we also called it as blockers. That we will learn further. So antagonist, it will have ability to bind. Plus here the response is 0. There is no any response from the blockers. And next one is inverse agonist. So what is inverse agonist? In inverse agonist, we will say ability to bind. And next one is -1. So -1 means the response is clear-cut opposite to the action produced. That is opposite response. So for this, let's draw a graph. How? Very easy to understand. So let's draw a graph. This is a graph. So here is +1, 0 and -1. So what is this? This is agonist drug. That is, there is a maximum response, right? There is a maximum response, so this is an agonist drug. And if you take here if you take, there is not maximum response, and the curve is slightly becoming flattened. Okay, so here if you say, it is called as partial response. Partial response. And we have seen that what 0 means there is no response. That is antagonist. This drug is antagonist. And next is -1 response, which is that is opposite reaction. That is inverse agonist drug. So let's find the examples of this. Let's remember the examples of each drug. So agonist drug is BSDs or Z drug. What is BSDs? That is benzodiazepine. Benzodiazepine, which is a sleeping drug. So here is a sleeping drug. And for partial agonist, next one antagonist, the drug is flumazenil and the beta carbolin. Yes, so this is a simple way to understand the agonist, partial agonist and inverse agonist drug. Hope you find